Have you ever finished a virtual doctor's visit feeling like something just was not quite right? Or perhaps you experienced a frustrating technical issue that really impacted your ability to get the care you needed. It is completely understandable to feel uncertain about what steps to take next, or who to even talk to when something goes awry in a telehealth appointment. When you find yourself with a complaint or concern about a telehealth service, your very first and most direct course of action should always be to contact the specific healthcare provider or the clinic that delivered the service directly. This initial step is almost always the quickest and most effective way to address and resolve your particular concerns. Starting with the original provider or clinic is essential because they are usually equipped with internal processes designed to handle patient feedback and grievances efficiently. Many larger healthcare systems, for example, have dedicated patient relations departments, ombudsmen, or customer service teams whose primary role is to listen to your issues, investigate them thoroughly, and work towards a satisfactory resolution. They are best positioned to understand the context of what happened and have the authority to implement corrective actions promptly. Thinking about external regulatory bodies should generally be a secondary step, reserved if your initial attempts with the provider are unsuccessful. To begin, take a moment to carefully gather all the pertinent details about your recent telehealth experience. This preparation is key to making your complaint clear and actionable. Be sure to note the exact date and time of your virtual appointment, the full name of the healthcare provider you interacted with, and a precise description of the specific issue you encountered. For instance, was it a persistent audio or video problem, a feeling that your concerns were not fully heard, a billing discrepancy, or perhaps a delay in receiving necessary follow-up information? Once you have these details organized, reach out to the provider's office. You can often find contact information for their patient services or patient advocate department on their website or by calling their main number. When you communicate your complaint, whether by phone or in writing, clearly explain what happened, present your organized facts, and state what resolution you are seeking. Be polite but firm. If, after giving them a fair opportunity, the issue is not resolved to your satisfaction at that level, you can then consider escalating your concern. Depending on the nature of your complaint, this might involve contacting your state's medical board or professional licensing authority, which oversees the conduct of healthcare practitioners. For issues related to patient privacy or data security, especially concerning your personal health information, federal agencies like the Office for Civil Rights are the appropriate body to contact, particularly if your complaint involves potential breaches under the Health Insurance Portability and Accountability Act, or HIPAA. A valuable piece of insider knowledge is understanding the critical role of a patient advocate. These dedicated professionals exist within many healthcare systems, specifically to act as a liaison between patients and the medical staff. They are there to representing your interests, help you navigate complex procedures, and ensure your voice is heard and your rights are protected throughout the complaint process. Furthermore, knowing that your privacy rights are explicitly safeguarded under HIPAA means you have a powerful tool if your personal health information is mishandled. Any violation of these regulations is taken very seriously, and understanding this empowers you to protect your sensitive data. Ultimately, taking proactive steps to address your telehealth concerns not only helps to ensure that your own individual care experience improves, but it also significantly contributes to the overall enhancement of telehealth services for everyone. By equipping yourself with the knowledge of who to contact and the appropriate steps to follow, you can confidently navigate the system and effectively advocate for the high-quality virtual care you truly deserve. Your feedback and willingness to speak up are genuinely invaluable in shaping a better digital health landscape.